After years of enduring excruciating pain as a result of sickle cell disease, Victoria Gray in 2019 decided to take part in a historic clinical trial to edit her genes using CRISPR. Pronounced 4 years on, Victoria Gray does not have symptoms of sickle cell any longer. Portia Gabo, in an exclusive interview with Victoria Gray and her doctor, explained what CRISPR is and why a cure for sickle cell disease is almost here.
It is a genetic disease that causes unimaginable pain.
When someone has sickle cell disease and is in pain crisis, it's like a regular person having your bone twisted. It's very painful.
Unimaginable pain episodes that 38-year-old mother of 4 from Mississippi, United States of America, Victoria Gray, could relate to.
At the age of 3 months, that's when I was diagnosed with sickle cell disease. That's when I had my first crisis. I had a lot of hospital stays, a lot of pain. Yes, the pain episodes, they would come on random. I mean, I could wake up and feel good. And then in a matter of minutes, I have pain that would possibly start in my leg or either my arm, and then it would travel across my chest into my other arm. It felt like I was being struck by lightning because it moved so fast, like electricity, and it would just bounce all around my body. It made me sad because I could hear my grandmother's prayers out loud, just begging God, to give me some relief, to take away my pain.
In 2019, Victoria voluntarily took part in a clinical trial to see if cells removed from her bone marrow could be edited using the novel CRISPR-Cas9 treatment.
At that time, in that hospital stay in Nashville, Dr. Frangul, he sat beside my bed and he asked me, have I ever heard of CRISPR? And I told him no, I had never heard of it. And he sat down and he explained to my husband and I what it meant, how it would work in theory, because it hadn't been tried. And he explained that I would be the first person to do it if I decided to say yes. He answered my questions, but I did have to come back to my faith and pray.
Dr. Haida Frangul, Medical Director of Pediatric Hematology and Oncology at the Sarah Cannon Research Institute and HCA Healthcare's The Children's Hospital at TriStar Sentinel, is the doctor that treated Victoria Gray.
The CRISPR gene editing is a technology where you can edit a specific area in the genome. So there are hundreds of thousands of genes in the body, correct? In each cell. And we are able to use CRISPR-Cas9 as a genetic tool to edit a specific area in the genome. And in the case of sickle cell disease, what we are doing is we are editing an area in the genome that will allow the stem cells to make high levels of fetal hemoglobin, a type of hemoglobin that will help the cells, the red blood cells, not sickle and be mal-shaped, and thus prevent the complications of sickle cell disease in patients.
4 years after undergoing treatment for sickle cell disease using CRISPR-Cas9, Victoria says all her symptoms of sickle cell disease are gone.
My life has really been transformed. I haven't had any emergency room visits, any blood transfusions. I now work a full-time job. I now take care of myself. I don't have anyone that I have to pay to come over to help me get dressed or clean up my house anymore. I get to live life as a normal person now.
I asked Dr. Frangul if this means the world now has a cure for sickle cell disease.
Well, this therapy eliminates all the complications that are related to sickle cell disease, including pain crisis, acute chest, admissions to the hospital. Our data show that more than 90% of the patients after this therapy had significant benefit from this therapy, meaning they remain sickle cell free.
The United States Food and Drugs Authority has now approved 2 gene therapies for sickle cell disease. However, questions on health equity and pricing for the treatment arise, especially on how persons with sickle cell disease in countries in sub-Saharan Africa, including Ghana, can also access treatments.
I am really hopeful that this therapy will be available to patients worldwide, and specifically in areas like Ghana, where sickle cell disease is a huge problem. I am very hopeful that this therapy not only started the journey of CRISPR-Cas9, but also will allow other people to do other therapies using this technology to cure sickle cell disease.
Victoria Gray's courageous decision to partake in the pioneering gene editing clinical trial is historic.
I can dream again because I had stopped dreaming and hoping for anything, you know. So now I have big dreams and big plans. After the treatment, I wanted to be a sickle cell advocate. So that's what I've been doing since I've been treated, because I didn't want to open the door and not help others to come through the other side, because it's a great feeling and I want other people to experience that also.
Dr. Frankel had a message for persons living with sickle cell disease in Africa.
Well, I think you really need to tell your patients with sickle cell disease that there is hope on the way. That's very important.
The world is now a step closer to a cure for incurable genetic diseases. Portia Gabotti with 3 News, Accra.